Would you support vaccine mandates?
Well, look, I always think it's better to educate people into compliance if we can, but we can't live in a world where only certain people are taking the vaccine and some are opting out. That won't help anybody, and that will perpetuate the spread of this incredibly deadly violent virus. So we're looking at a range of options, but our first choice, obviously, is educating people into compliance, demonstrating to them the safety of the vaccine. I will take the vaccine, as will my leadership team, and we're encouraging people of good will and faith across the city to do the same. And I think once we see that trend, and influencers, whether it's local elected officials, whether it's local stakeholders, people in the faith community, we'll see the trend turn in the right direction.
So you got to eliminate that compliance, and you make it a mandate, and then you do training, particularly in the city. I'll call them licensing departments, whether it's zoning, buildings, housing will be impacted by it, planning certainly, and you pick the people to run those agencies and the deputies that are pledging allegiance to the new world order and good governance, and then I think you have the inspector general do some spot audits to make sure that there is real compliance.
And then finally, we'll be moving towards this mass vaccination campaign and continuing to follow. And I want you to know that CDPH is already deep in the planning stages around vaccination. We've already bought the syringes. We already know where it's going to happen. We're thinking about what that's going to be. It's all part of this plan. And then thirdly, vaccination registration. So looking even further ahead, we are already building our plans to vaccinate the whole city of Chicago and working with others across the region on a major plan for this. We've bought syringes, we've bought cold boxes, we've planned out locations, but we want to make sure that as we develop these plans, we're already thinking about the technology that we'll need to use. We don't want to be vaccinating people using pieces of paper and faxing and materials. We want to be doing this really in a way that, again, allows us to link people's symptoms to their test results, to their vaccination. We're doing a lot of that already through linking up electronic health records, but this gives a way for individual residents to actually keep track of symptoms they've had. And so the thought is that we likely won't have this vaccination campaign, as the mayor said, until 2021. Registering now, I want to be clear, does not put you first in line for a vaccine. We will be making those decisions based on major public health prioritizations, but they will be the first step for getting your information in a way that we need to capture what information from you to safely vaccinate you and really keep track of this as a whole city. And when a vaccination becomes available, we'll be able to hit the ground running. We're also looking at our flu vaccination campaign that we'll be running this fall and winter, and thinking about, again, how can we use existing technology? How can we make sure that vaccination itself is done in a way that is safe and has social distancing? So this, again, is a first step. You register, you give us some pre-information, we can communicate with you about vaccine.